Watch these short videos to help you assess different joints of the body using orthopedic tests. This is the anterior apprehension test or crank test for anterior ligaments in the shoulder joint. So let's go to this position here. Okay, I'm going to support at the arm and my hand is going to go on the top of the humerus here and I'm just going to push the humerus forward. If there's excessive movement across the front of the shoulder joint or pain, that would be a positive for this test. This is the posterior apprehension test for instability of the posterior ligaments in the shoulder joint. So for this test, we're going to take them to this position here. I'm going to cup the elbow and my hand just goes around that medial border of the scapula and I'm going to pull the humeral head this way. Apply some traction through the joint, and if there's excessive movement or pain at the posterior shoulder, that would be a positive for this test. This test is called the Adson's test for Thoracic Outlet Syndrome, which is a condition that affects the brachial plexus and the arteries going underneath the clavicle here. So for this test, we're going to take the arm into a supinated position. We're going to take the radial pulse. That's it. Once you've got a nice strong pulse here, so we're going to hold that. So I'm feeling the pulse. I get my client to look at me and then drop their head backward and take a nice deep breath and hold that for 10 seconds. And within that time, if they have thoracic outlet syndrome, you will find the strong pulse dropping down to quite a weak pulse or disappearing. And breathe. Okay, that was a nice strong pulse throughout that. But if it dropped down and you couldn't feel it, that is a suggestion for thoracic outlet syndrome. And thank you for watching.